Let's discuss John's criteria. The John's criteria is used for the diagnosis of rheumatic fever. Rheumatic fever is a multi-system inflammatory disorder which occurs secondary to the pharyngitis caused by group A beta hemolytic streptococci. The John's criteria have two parts, the John's major criteria and the John's minor criteria. The John's major criteria have five constituents. The first one is a migratory polyarthritis, second one is a carditis, third one is subcutaneous nodule, fourth one is a skin rash erythema marginatum, and the last one is a Sydenham Chorea. Remember that for the mnemonic which we use for the major criteria is John. J stand for joint disease, O in a form of heart represent the carditis, N for nodule, E for erythema marginatum, and S for the Sydenham Chorea. Let's discuss this major criteria in detail. The first one is the migratory polyarthritis. What we mean by migratory polyarthritis? It means that a patient will have arthritis of a one joint, and when the arthritis resolves, the patient will develop arthritis in other joint. So there will be a shifting of arthritis in joint. It is called as a migratory polyarthritis. The second one is carditis. The rheumatic fever affects all the three layers of heart, including endocardium, myocardium, and pericardium. The third one is subcutaneous nodule. You guys can see the subcutaneous nodule here. It is a painless nodule which lies subcutaneously. The fourth one is a skin rash. The skin rash of rheumatic fever is called as a erythema marginatum. You guys can see the erythema marginatum in this image. It is a pink or red non-itchy rash with sharply defined border with pale center, and it is usually present on trunk and limb. Last one is the Sydenham Chorea. The Sydenham Chorea is a rapid, incoordinated, jerky movement primarily affecting the face, hand and feet. You guys can see a child having Sydenham Chorea in this image. Remember that the migratory polyarthritis is the most common initial finding, and the Sydenham Chorea is very late manifestation of rheumatic fever. So it was all about the John's major criteria. Now shift our attention toward the John's minor criteria. The John's minor criteria include fever, arthralgia, elevated ESR, the heart block. By the heart block we mean the first degree heart block, and the leukocytosis. So these five are included in the minor criteria of John's. And now we have discussed the major criteria and the minor criteria. But a question arises that how we will diagnose a case of rheumatic fever on the basis of John's criteria. So the John's criteria state that in evidence of preceding group A streptococcal infection, mean that when we have evidence of group A streptococcal infection, and what is the evidence? A positive throat culture or the increased anti-streptolysin O titer. Evidence of these two tests, if there are two major criteria or the one major or the two minor criteria are fulfilled in a patient, we say that the patient is having a rheumatic fever. For example, if a patient present with a skin rash such as erythema marginatum along with a migratory polyarthritis, and a patient give a history of pharyngitis 2 to 4 weeks back, having a positive test of a throat culture and anti-streptolysin titer are raised. So we say that the two major criteria are filled in evidence of preceding group A streptococcal infection. So the patient is having a rheumatic fever. So it was all about the John's criteria. If there is still any question, you guys can ask, and stay tuned for more update.